You're listening to The Q Switch with your host, Spence.
Welcome, one and all to the Q Switch Conversations podcast. I'm your host, Spence, and the mission of this show is to tackle subjects currently impacting ophthalmology and pull in leading eye care professionals and industry players to discuss their unique perspectives. So let's get into it. Today, I'm thrilled to be joined by someone who embodies the evolution of modern optometry, Dr. Azalea Garcia from Family Eye Physicians in Chicago, to discuss the changing face of optometry. Born and raised in the Windy City, optometrist Dr. Azalea Garcia is as authentic as they come. A proud native of Chicago and reflecting her hometown, she brings a warmth, energy, and determination into every patient interaction that's hard to miss. After earning her Bachelor's of Science in Biology from Loyola University of Chicago, she took her talents east to Beantown and the New England College of Optometry in Boston, where she honed her skills and developed a passion for treating the most complex vision challenges. Her training reads like a roadmap of excellence, people, from Boston Medical Center and Manchester VA Medical Center to the Global Vision Rehabilitation Center in Miami, where she mastered the art and science of specialty contact lens fittings and earned clinical honors along the way. Today, Dr. Garcia serves as the clinical lead optometrist at Family Eye Physicians, one of the premier ophthalmology and optometry practices in the Chicagoland area, a practice known for its commitment to comprehensive, compassionate, and cutting-edge care. She's at the forefront of a new generation of optometrists redefining what it means to deliver full-scope, medically advanced eye care, blending innovation, precision, and heart in every patient interaction. It's a privilege to have you with us today. Dr. Garcia, welcome to the Q Switch.
Thank you so much for having me, and thank you for that amazing introduction. Have me back anytime.
Well, you certainly deserve it. So
Thank
let's
you.
start at the beginning. You grew up there in Chicago, studied biology at Loyola, then went on to Boston for your optometry degree, and finally advanced specialty training in Miami. That's quite the journey. What first drew you to optometry, and how did your Chicago roots influence the way you practice today?
My first interest in optometry came when I was very, very young. 3-4 years old, just because I've always needed glasses and contact lenses. I'm a high myope. I'm a -9 in both eyes. And so yearly trips
okay.
to the eye doctor was part of just my childhood and growing up. And not just me, all of my other siblings as well. Sorry to call them out like that. We all have very high prescriptions. And so it was something that I genuinely looked forward to every year. Like, I loved going. We went to the UIC Eye and Ear Infirmary. We went every year. It was just, for me, it was such a treat. And one of my favorite parts of the exam was when the doctor or the optometrist left the room, and I would just mess around with all the equipment because I thought it was so cool and so interesting. And now as a provider, I'm like, wow, I must have really messed up the whole flow with my curiosity. But I just always had an interest for it. I always had a passion for it. I always just thought that this was something that I could do, and I found a lot of passion in. I would lose every sense that I had before I lost my eyesight, and it's obviously something that's very important to our day to day. And if that's how I could live my life, and that would be a very fulfilling life, to be able to help people and make kids and patients feel comfortable and excited to go to the eye doctor and look forward to go to the eye doctor every year, that would be very fulfilling for me. And that's where it started. My roots in Chicago, absolutely. My first mentors were the Perez twins that were also born and raised in Chicago. They were Latina women as well that started their own optometry office in the city and in Pilsen. And they were, again, my first mentors. I remember just going to their office. I shadowed them one day and I never looked back. That was my only career path after just meeting them and hearing their story and how much I related to it. And it just really went from there.
What a great personal story. Thanks for sharing that. Now, optometry has evolved so much over the last few decades. It used to be all about prescribing glasses, contact lens fittings, and routine eye exams. But today, it's become far more medical and specialized. From your perspective, how would you describe that shift, and what's been the biggest change you've seen in how optometrists care for patients?
Well, I mean, I knew from the jump that the routine eye exams, the glasses, contact lenses, that was not where my passion was. My passion and what I really was interested in doing was doing more of the medical side of optometry. I think that Yes, there's a place for it. 100%. Retail optometry, the quick exams, just filling glasses, filling contact lenses. That yes, that's very, very important. But I think as how business works and how profitability works, unfortunately, you have to offer more to that than patients. You have to offer more of a comprehensive approach if you really want to stand out and if you really want to provide a different level of care. You have to be able to provide the space for diabetic eye exams, glaucoma management. You have to have the equipment for that, and not a lot of those retail places do, which is fair, again, because that's not what they're there for. And so I think that it's definitely changed because there was such a need for it, especially in the bigger cities where ophthalmology offices were getting really flooded. We needed to be able to step up as a profession, of course, know our place, but be almost like the primary care doctors of the eye world, so that we can kind of see and screen what's going. We can manage basically diabetes until lasers and injections are needed. We can follow those patients. We can manage glaucoma with drops. And if we're at a clinic that's lucky enough to be able to provide, to have MDs that can do lasers like SLTs or even omnis for patients, to be able to help manage that and be a part of that management until they need to see a glaucoma specialist, be able to monitor cataracts and be able to kind of hold patients' hands in that journey with them until they're ready for surgery. I think that shift came out of a necessity for how much need there is in healthcare and how much need there is in patients needing to be able to see. So it was kind of like sink or swim. And if you couldn't kind of change with the times, then you'd just kind of be left behind. You would be just kind of back stuck just doing glasses and contact lenses, which if that's what you wanted, for sure. Again, I think there's a place for it, but if you wanted it to if you are the type of provider that wants to be able to do more of a comprehensive medical systemic approach to your eye care, you had no option but to change with the times.
So you've built a strong reputation for fitting specialty contact lenses and treating complex corneal diseases, which, let's be honest, takes real skill and patience. What got you interested in that area of specialized care, and what's it like when you see that moment of joy when a patient who's seeing clearly for the first time in years?
Oh my God, there is very few feelings that are as fulfilling as that. But kind of what I was speaking to before, I do think as an optometrist to be able to really stand out and provide care that's very like you have to find a niche, you have to find a specialty, whether that's medical, whether that's pediatrics, whether that's low vision. But for me, then what I really loved and really found interest in and found a lot of joy in is in fitting those specialty contact lenses. And so that really started when I was with Dr. Boschnick in Miami. And it was remarkable, the technology. It was insane to me how patients went decades not knowing that there was something better for them out there. Being,
Really? People go
25, 30,
5, 10, 20 years without knowing that their vision
yes,
can be
that
improved.
they
Just kind
were
of
just told, like, this is it. This is the best we can do. These glasses are the best that we can do for your keratoconus. I mean, granted, technology has changed a lot in that time as well, but it was just mind blowing to me how people would go on for years saying that I never knew, I just accepted it. I never knew that there was anything better. And so I wanted it to be the something better to be able to give to patients. And so, yes, it takes a lot of time, it takes a lot of chair time, it takes a lot of skill, but it is so rewarding to be able to hear a patient say, like, well, I can work again. Like I can drive my kids to school again. Like I can, things that I think some people kind of take for granted, which again, you don't understandable, but something that people take for granted that changes their lives, their day to day. Again, their ability to make income so that they could take care of their families just with fitting a specialty lens, fitting a scleral lens. Again, that need and that niche is there. And it's so, keratoconus is so, like, just to give an example, is so much more prevalent than we ever thought it was before. And not even just that, like post-transplant corneas, even though you have like a corneal transplant, you still almost should be fit with a specialty lens at some point, or will likely need to be able to really protect the transplant and also optimize the vision. And just again, that alone is so life-changing for the patients. And there's just nothing more rewarding than just seeing the gratitude and again, just being able to help someone just kind of function normally, which they deserve to. And that's what we're here for.
Sure, sure. Well said. So Family Eye Physicians has been serving Chicago for over 20 years and is known for its comprehensive, patient-centered approach. How would you describe the practice's philosophy on care, and how does that culture shape your day-to-day work with patients?
So what really drew me to Family Eye Physicians and that culture that commitment to not only excellence but comprehensive eye care. We really pride ourselves in being pretty much a one-stop shop. We offer glasses, contact lenses from the optometry perspective, comprehensive routine eye exams, diabetic exams, glaucoma management, macular degeneration, retina care, dry eye care, and in terms of technology, have a lot of it. We have pretty much every OCT, fundus photo, optos, VEPs, ERGs, of course, all the dry eye, testing, pentacams. We pretty much have everything to be a hub for all of the other offices, whether it's an ophthalmology office that may not have as much technology or other optometric offices that don't have those, that technology or that imaging or the capability or really the time, or that's not what their practice model is. We are like that referral center, and not even just for other clinics, even down to the hospital. We're right across the street from Christ Hospital, which is a level 1 trauma care. So we get all of their referrals as well. So
Oh,
we
okay.
really are committed to being that place that not only patients can come to get everything that they need in terms of their eye care to an extent, of course, but also be that kind of safety net for all the other ophthalmology hospitals that, okay, we got them. We can take care of them. You can feel comfortable to know to send your patients to us and to know that we're going to take care of them to the best of the ability with all of the services, imaging, technology that we have at our disposal that we're so grateful and so lucky to have at our disposal to be able to manage these cases and be able to manage these patients. And so really that's our philosophy, and being able to really take care of anything and not turn away anything and not be intimidated by anything, so that we could be that referral center. We could be that place that we got you.
Sure, sure. So I'm glad you spent a lot of time touching on the technology, because it's impossible to ignore that the AI has an increasing role in healthcare. From diagnostic tools to workflow automation, it's literally everywhere. How do you see AI changing the way optometrists practice, and what excites you most about that integration?
I'm really, really excited to see, and I'm so very lucky that I'm in that time and in that era where we're seeing it get integrated into healthcare. AI is going to be able, if I'm being honest, AI is going to be able to automate a lot of things that optometrists can do. Things like refractions, things,
And that's a
mainly
good thing?
refractions. Refractions, I think at some point we are going to get there to be able to, maybe not complex refractions, of course, maybe not carrot, but I think for your basic 2 diopter myope or basic 3 diopter, maybe hyperope, I do think that robotics are going to get to the point that they're going to be able to do that. And not even just the skill sets. I'm talking even front desk, scheduling appointments. I do think that AI is going to get to the point to be able to replace a lot. And that's where specialties are important. A bot is not going to be able to fit a scleral lens. A bot is really not going to be able to do, at least I don't see it in the foreseeable future, a really good prism evaluation or a low vision evaluation. But what I'm really excited about is I think AI is going to make care a lot more accessible. For example, if we can do like diabetic screenings, to say, all right, take a retinal picture, put it into a program. Hey, you look good. Still go, but you can wait like 3 months. Or I'm seeing red flags all over the place. You need to go within like 48 hours. Let me also give you a map of like the most local or the closest offices and to your area, and that also accept your insurance. I think that would be a very useful way for AI to be integrated, at least into optometry and ophthalmology, to be able to facilitate and screen patients for how soon or how quick they should get into the office for their systemic conditions. Or like, you know what, these images look terrible. We don't know what's happening, but you need to go right away. So I think for screening purposes, AI is going to be, and I'm excited to have that integrated in that way.
So, of course, on the other side of that is the human element, that one-on-one connection that's so important in eye care. Do you think technology will enhance that relationship or risk taking some of the personal touch away? How do you balance the two?
That's a really good question. I do think that human to human interaction and that connection that you make between patient and provider, um, with technology it's inevitable that it's going to affect it and maybe hinder it. But how to balance that? No, I don't really know how that's going to look. But I do think that, at least for me and for where I'm hoping that AI and what technology, how it helps us is more so to be more accurate in diagnoses, a more comprehensive differential diagnoses, more better, maybe helping us come up with more treatment managements that can incorporate patients, maybe financial limitations or location limitations, things like that, as opposed to getting patients out of coming into the office. So I would like technology more so to be an aid into how we practice and how we care and how we manage our patients and how we treat our patients, as opposed to removing them completely from coming into the clinic, coming into the doctor's office, because I do think that human to human interaction, and that is important, not just for healthcare, but just as humans and as, developing social skills, especially when, people were growing up in this age of technology. So it'll affect it to some degree. I think it's inevitable, but my hope is that it doesn't completely, and I don't think it will completely take that away.
What I would like to see and what I would expect is that because AI, it's like the ultimate easy button, adding efficiencies and doing all the stuff in the background that, and like I said, doing all these things quicker and easier and faster than we could as humans, and can easily become a crutch instead of a tool. And being able to, maintain that human connection, that interaction piece has to be very intentional. It has to be something that you deliberately decide on doing and execute.
Yeah.
And it can't be just one provider at a multi-provider center like yours. It has to be everybody on the level having that same mindset. And it's a culture and mindset where it's intentional, and that AI is great, but as you said, it's an aid, it shouldn't be out front. And I'm hoping and expecting that if you're a patient-centered, patient-focused clinic or surgery center like yours, that there won't be too much lost in that transition.
Right. And I mean, as a healthcare provider, like, I don't want to lose that. Like, I love connecting with my patients. That's part of that's one of the best things about my job is I get to meet 30 new people a day, 40 new people a day, and learn about them. And hey, how's your family? How's your kids? Like, when are they coming in for their exams? Like, that aspect of care is amazing. And I would hate to ever see that go. So I hope that AI doesn't, and where it's going doesn't, and it shouldn't, completely take that away, because it is important. It is part of care. It is part of people feeling good and feeling comfortable coming to you. And like, there's a reason that I'm coming to, Dr. Garcia or Dr. whoever, and like, I'm bringing my family to her, because of that human interaction, because of that connection. There's a certain comfortability that as a provider that I want to be able to give to patients, so that they not only trust me, but keep, coming back, and, keep, their faith in me that I'm going to take care of them, and keep their trust in me and in my management plans and in my care for them. I mean, we call ourselves family eye physicians for a reason, because we want you to see not only you, but we want to see your whole family. We want to take care of your whole family. We want to make sure that everyone has access to us and to our resources, and to the level of care that we really pride ourselves in providing. And I don't see a robot being able to take that, from us.
I agree. So, Dr. Garcia, you've incorporated some cutting edge technology and treatments in your practice. Are there any particular technologies, devices, or pharmacological advances that have become your go-to, the ones you rely on most to deliver better outcomes for patients?
So again, I think that depends on what we're treating and what condition we're treating. So dry eye is a hot one. Everyone's talking about it with pharmaceuticals and eye care pharmaceuticals. That's always something coming out. Like, it was Mibo, it was Vivi, now it's Triptyr. So I always like to stay on top of that and what's coming out, when it's coming out. If maybe I've had a patient on Vivi for 6 months and it's helping, but maybe this patient is still, having some dry eye symptoms at 3 p.m. Then, maybe let's see if Triptyr works as something that can be used on top of that. And so we're also really lucky that a lot of the reps will, because we are a bigger fish, we're a bigger clinic. So we are a stop on when there is ever new drops. And so right now I have been really loving Triptyr and the response that I've been getting with that one. And that's a new dry eye drop that just came out on the market, I want to say just a couple of months ago. It's not new, but it's not something that's super commonly done, but amniotic membranes are one of my favorite treatments. I really have seen a lot of benefit in that. I really love amniotic membranes, both the dehydrated ones and the cryopreserved ones. I think that they are worked phenomenally for me for dry eye management, really keratitis that no matter what you throw on it, doesn't go away. Recurrent corneal erosions, I've really have had great success with that. I like to preface patients like you're not going to like me for the first day that I put a Procara on you. You are going to go home and be like, what did she just put on my eye? Like, I'm never. But once it comes off and how you start feeling the next couple of days, oh, it's amazing. I've had such great success with those. A lot of the things that I really talk to patients about in terms of newer technology and things that are out there are actually cataract surgery lens implants. A lot of patients don't really know or are aware, and that's really where we step in as the optometrists doing these cataract consultations. They're different lens options. They kind of just go in thinking, all right, I have a cataract, you're going to take it out, you're going to put a lens in, and I'm going to be good. But no, there's so many options out there. There's so many lenses available for multiple different uses, whether it's distance only, distance intermediate, or distance intermediate near. The light adjustable lens, we introduced that in our clinic, and that's been great. I think if a patient's a candidate for it and they really want the most kind of customized cutting edge technology, that's my go-to for that. I start off with that if you wanted something that's going to give you this after surgery, you really want to be able to customize your cataract surgery. You really want to be in control of how you're seeing, the focal distances that you want corrected for based off of your lifestyle. Like that's the type of technology that you're going to want to go for. That and the PanOptix lens, I've had really great success with patients and recommending that, and also the Vivity lens as well for my kind of younger cataract surgery patients that kind of just still haven't retired yet, but spend a lot of time on the computer. That's a great lens for them. And so usually those are like my go-to lens recommendations, based on the patient's need and what their post-operative outcomes are. So for me, I do a lot of cataract surgery talk and technology, and also the lasers that you can use to be able to make it a more precise surgery as well.
Well, I've been in the ophthalmology space since 2011, and I'd probably say in the last 5 or so years that the lens options, particularly in the advanced technology lens space, the presbyopia correcting lenses, you got the EDOFs, all these different acronyms, the alphabet soup of IOLs, and the fact that those conversations are being had in your clinics as as ODs is what I think is an interesting change, because you weren't having those conversations 5, 6, 7, 10 years ago. It's like, you know what, go see the optometrist or go see your ophthalmologist. They'll have the conversation. Now it's actually that conversation starts in your office.
Oh, 100%. And it needs to, because it's a big decision. It's how you're going to be seeing, like after cataract surgery, that lens implant, that's how you're going to be seeing until your last day. So it's there for life, right? And so it's a big decision, and you want to really give. What I don't like to hear is that, oh, I didn't know. Or like, oh, no one told this to me, or no one explained this to me, or they thought that I just wanted something or whatever my insurance was going to cover. And so they didn't even bother to tell me other options that were available to me. And that conversation absolutely starts in my chair. Any doctor that I'm onboarding or helping onboard to our clinic, any OD, I cannot stress how important that conversation has to begin with us, so that your ophthalmologist can just elaborate on it and go from there. So our job, like we do kind of a lot of the legwork. We'll do the initial consultation, the retinal exams, all of the, the optos, the OCT, give our recommendations. Like, I think you'd be a great candidate for the laser assisted version of cataract surgery based on what you're telling me about your life. I'm recommending the Vivity lens for you. You know what? You have some mild glaucoma, just throw an Omni in there as well. This is what I'm recommending. And so then your surgeon, all they have to see is your note, look at the images, of course, evaluate the patient, talk to them, be like, yep, I agree, and reinforce everything that we did. It just makes that decision more streamlined. And also it makes, the patient's experience better. It makes them feel more comfortable that we're all kind of on the same page. And, I did their preoperative care. Now I'm also going to take care of you after as well and do all of your postoperative care as well. I think that makes them more, comfortable with us and managing them when they realize how much of a team and how much of a team we are and how closely we work together, and how important that is.
And looking ahead, What innovations are you most excited about, whether it's in dry eye therapy, myopia control, or advanced contact lens design? What's coming that makes you say, this is going to change everything?
Well, anything contact lens related, I'm really excited about. Anything that where we can get more customized contact lenses for patients, lenses that are able to correct for more higher order aberrations, which we know are can be very visually debilitating for patients. You can be 20/20, but you can have these higher order aberrations, which are kind of like optical imperfections that can cause things like glare, starbursts, blurred vision, distorted vision, even though on paper and in your office, the patient should be seeing and should be very happy with the lenses that you've designed. So any kind of lens technology that helps correct for that or helps facilitate that, because that adds another layer of complexity to your fit. Dry eye is always something that I'm always really looking forward to getting. The new drops, the new punctal plug, the new membrane, any of those, I'm always more than willing to try and more very like looking forward to getting my hands on them. And I certainly have the patient population to be able to, I'll have one patient that I can use it on, one patient that I think would benefit from it. I'm also really excited about any kind of new lasers that are coming out to make cataract surgery easier, not just for the patient, but also for the surgeon as well. I was just at a talk with Alcon about one of their new lasers that they came out. And instead of looking through oculars, the surgeon is looking to a monitor, or I don't know how new it is, but newer for us. Instead of looking through oculars, they're looking at a monitor, and they're able to change the filters during the cataract surgery as well, to make the capsule much more easier to see. So it's easier to make the capsulorhexis. It's easier to remove the cataract. I'm always, looking forward to that and excited for that because, again, those conversations do start in my exam chair. Granted, I'm not going through all of the mechanics of the lasers, but to be able to speak to a little bit about what's going to be used, again, I think it makes the patient feel a lot more comfortable. And for me, I think a lot of dry eye comes from the eyelid. I think most times it's coming from MGD, blepharitis, a lot of it's coming from the outside working its way in. So any kind of lasers like IPL lasers, radio frequency, again, they've been around for a while, but every couple of years you see the advancement in, the quality of them, how severe of disease that they're able to treat, how effective they are. So things like that I get really excited about because, again, it's just another tool that we're able to have and be able to offer patients. Whereas like 10 years ago, for meibomian gland dysfunction, we really didn't have much. We just, all right, warm compresses, clean your lids. We'll see you in 3 months. Whereas now we're able to actually have conversations with patients about treatments, about lasers and things that they can do on a, consistent basis because we know these conditions are chronic to be able to give them relief.
Yeah, well, I'll tell you that we're very, very fortunate to be in ophthalmology and eye care because it is, and it's not even close in terms of advancing technologies and fast moving things that come to the market that improve patient care or technique. It's fast moving. So I mean, if you are into like advanced technology, anything, and you're in eye care, you're in the right place for sure. Whether you're an optometry or ophthalmologist, it really is one of those things that we're fortunate because. I think right now we're going through a renaissance with the IOLs, like I mentioned before. I was with Alcon for the better part of, I guess, 12, 14 years. And there were only maybe 2 or 3 phaco platforms. Now there's, I think, 7 or 8. Mm-hmm. So there's a boom in technology in all these different segments. And they're not all, cookie cutter. They all do something a little different. Yeah, they're all phaco systems or IOLs, but they all have their own matching of a patient and doctor and clinic. So I think the plethora of options is a good thing to a certain extent. It can be overwhelming to some folks, but I think that having the selection and not just 1 or 2 options is a good thing.
Absolutely. And it's crazy to think about even just in the cataract surgery world, how much technology has advanced. I really do think that the premium IOLs and that's it really, if we can get it and if you can get it, that's going to give you the most benefit to your vision, most range to your vision. But I was just talking to one of my colleagues how it's interesting to see how advanced and how much money is being put into creating new technologies, new lasers, new lenses, but cataract reimbursement rates, that's dropping every year.
Yeah. Yeah. And it almost, to offset the decreasing reimbursements, you have to it's not even a question. If you're not doing some form of patient pay technology, whether it's laser-assisted cataract surgery, advanced technology lenses, and some of those, again, where patients pay out of pocket for a different experience, a different result, a greater, outcome. It's almost necessary. You can't, the days of being standard cataract surgery and a monofocal are gone. And so
100%. You won't make
you
it.
have to diversify. You have to have that patient base that really caters to some of those, premium options, premium cataract surgery, and really diversify because, again, monofocal, standard cataract surgery, monofocal, it'll keep the lights on, but you will not, because chances are somebody up the street's going to have, that technology that you don't, and it kind of feeds on itself. You're kind of just a race to the bottom at that point.
Oh, 100%. Yeah, I firmly believe that. I think that if you're not at least offering something in that advanced space as a clinic, as a provider in this world where everything is faster, everything people want better, you're just, yeah, you're not going to make it. You're not going to make it very far,
Yeah,
unfortunately.
you're set to lose. At least that's my opinion. I think that's kind of just the going trend. So one of the things I really admire about family eye physicians is how seamlessly and symbiotically optometrists and ophthalmologists work together. How would you describe that relationship today compared to years past and when you first started your career?
I'll say that I've always been very lucky in terms of my relationships with ophthalmologists. I've always had very good relationships with them. I never really worked at a time where I wasn't an asset to the clinic that I was working in. And after I graduated, I was very set on the type of clinic that I wanted it to work at and the type of optometrist I wanted to be and the level that I wanted it to practice at. And so I knew that I wanted to do MD-OD. And so I don't have an experience outside of that, so I can't really speak too much. I've been so blessed and so lucky with the MDs that I've worked with. They really take into consideration what our opinions are and how to manage patients. They see us as an asset and they're very grateful. They're like, well, thank you, do all of the preoperative care. Just so all I have to do is, go in and see the patient, reinforce or disagree. I mean, by all means, like you can disagree with my plan as well. And so it just makes their consult so much quicker so that they can do more of them and can do more surgery and they can spend more of their time in the OR, which is realistically where they want to be. And so it's getting to the point where it's just like, yep, I'm going to refer you for injections, one eye and the other. Come back to me and we'll repeat the imaging. And so they'll just, yep, I agree and go about and do it. Or, you know what, I actually don't agree with you, but this is why. Like, I could see why you wanted to do that, but I'm going to actually start with laser first in this quadrant, and then I'm going to do it and explain to me their reasoning so that it's a learning moment for myself, as opposed to like, no, that's not right. Don't listen to her. She doesn't know or anything like that. It's been like, I'm very, very lucky. And if I have like a debridement that's just, I'm struggling a little bit with more so in the beginning, like I have the corneal specialist, like, hey, can you just pop in and finish it off for me? Like and of course, no questions asked. I'm there. Let's do it. And then we'll manage the patient together. And so again, it's really, really important, I think, especially for patients to see that we're working as a team so that they feel comfortable seeing, myself in their post-operative period, whether it's cataract surgery, corneal transplantation, after the Omni procedure, because, understandably, they're like, well, I want to see my surgeon. I want to see the one that did the surgery for my care afterwards, which again is understandable. But because that we make it a point to feel like it's a team effort and that you have a team of us taking care of you, it again makes that process so much more seamless, so much more comfortable, so that again, we can, and the goal is to really make their schedules more catered, the MD schedules more catered to, surgical consultations, as opposed to, a post-operative care or like a dry eye patient or a blepharitis patient. Because at the end of the day, yes, they want to, sure, they want to see it, but where their time is and where their value is, it's in the OR.
Of course. So, I mean, it sounds like you have a really great situation, awesome culture with a great team around you, both of ODs
Yeah. I'm really
and MDs.
lucky.
So do you see that collaboration in the whole of eye care continuing to grow in the future, especially as optometrists, as you mentioned, expand their role in disease management and post-surgical care beyond your situation?
Yeah, and it absolutely has to. I think it's a benefit for everybody, to be able to work together and to know what our place is and what our role is and where we could be of a benefit and where we can be of an asset with our skill set and with our training. I can't see a space where that where that isn't a necessity. Again, like we just want to be able to prep the patients and take care of them up until they absolutely need to either have surgery or injections and lasers. And the best way that we can do that is to be in communication and to collaborate and to respect each other's role and respect each other's expertise. Again, I'm very lucky where I've been in a clinic where that's just been the culture and that's been the mentality. I don't see a space where that wouldn't continue to be a benefit to both patients and to both, the eye care world.
So for me, as I see it, kind of big picture, I just don't think that there's enough ophthalmologists to meet the demand. So
Right.
there's just not enough hours in the day, enough providers on the ophthalmology side, on the MD side, to meet the demand of patients coming in with these different eye conditions.
Sure.
It's a much higher volume of patients that come in to get cataract surgery, with the kind of the baby boomers now getting to that age where they're getting cataracts. So I just think that to offset that limited, I guess, availability to treat in
Mhm.
terms of personnel and time, you have to move some of that to the optometric side of things, just to be able to diagnose, manage and treat these patients, aside from the actual surgical segment that obviously they've trained and are experts in.
Yeah. Yeah, absolutely. And I mean there is such a demand, there is such a need, and there is such a high volume of patients that are coming in. And I mean even our schedules, some of our MDs, they're pulling, depending on the day, 50 patients a day. And that's at our clinic when sometimes we've got multiple providers in an office, not just one. And so the need and the volume for patients is there. And again, that's, I mean, you said it really beautifully. That's really a place that we can step in. And I see optometry and I see our role growing to be able to manage these conditions, these dry eye patients, these cataract patients, these diabetic patients, these patients that have a third nerve palsy, or be able to care for them so that we can lighten that load for the ophthalmologists and give them again their space, which I think for me, of course, or at least in my experience and in my clinic, like their space is surgical, right? And of course, in the severe cases, of course, you've got a massive central corneal ulcer. That, yes, take care of that one for me, please. That one's coming to you right away. But at least, we can get them started on their antibiotic. We can funnel that a patient immediately to where they need to go. So even in that setting, we still have a space for it. But 100% as the need for patients grows, I think our scope and what we're comfortable seeing should grow with it. And I think that's the best case scenario for optometry and ophthalmology to be able to work together and coexist in a space where we kind of manage the same body part.
So, all right, Garcia, there's also been a lot of conversation and in some cases controversy around the use of ophthalmic lasers by optometrists, something a growing number of states have already successfully legislated, with more to come. What's your take on that, and what are the potential benefits, and what challenges does the profession still need to work through before that becomes mainstream?
So, I mean, I'll be the first to say I didn't go to medical school. I didn't have that training. I don't have that training on how to perform those procedures. But what we were speaking about earlier about the high need of patients to be able to get some of these procedures, I don't know, maybe like in somewhere like Chicago where ophthalmology and access to an ophthalmologist is a little bit more accessible than maybe a rural town in Oklahoma or a rural town in, you know, Arkansas, or somewhere where the population isn't, or the access to an ophthalmologist that even has that capability is feasible. But maybe that'll take you 30 miles to get there, or it'll be 2-3 weeks before you're able to do something like an LPI, which in some cases needs to be done right away. It's of the essence for it to be performed within a 24-hour period. And so I think that with the right training that is very carefully curated by, ophthalmologists and people that have had the training to do these procedures, I do think that there is a space and a need for that in places where access to care is much more limited. Things like a YAG, things like an SLT, I do see the value in an optometrist being able to perform that, again, where access to care isn't as abundant as it is here, like in Chicago or in Miami or in New York, or one of those bigger cities where there is more ophthalmologist to people. I see it being a challenge to get it approved where, again, access to care isn't as much of a limitation. But when it's much more, the population is more sparse, I do think the benefits can outweigh the potential risks for the patient in those settings.
So every field has areas that fly under the radar, needs that don't always make headlines but affect real people every day. In your view, what's the most underserved or overlooked area in eye care right now that deserves more focus, attention, resources, and support?
Hands down, low vision. The respect I have for the eye care providers that do low vision and offer those services to their clinics in their clinics is so profound. I mean, these are patients that aren't always, your macular degeneration patients. No, these are patients that maybe were born with like an optic atrophy or were born with a retinal condition that slowly progressed and they're blind by the time they're 20, 30. These are the patients that have had severe trauma to their eyes and lost their vision. So these are the patients that have had maybe like a pediatric glaucoma and, have lived their whole life without any functional vision. And I know for me, that's one of the toughest conversations that I sometimes have to have with patients that they come in and, you know, sure, I can manage the condition, but I don't have the tools. I don't have the capability. And I actually don't have the training or the knowledge to, I mean, we learn low vision in school, but, that's something that you have to continue. That's something that you have to always kind of practice. And, I can't do it. I can't help. This is what you need, but I can't help you. And sometimes the clinics that are able to do it, they're far away. Or they just can't get to it, or they're booked out for months in advance, or those clinics that do offer it, they're overbooked and overworked, and so of course there's provider burnout. So to be able to have the time and the patience to perform those kinds of exams, because they are longer exams, and to be able to piece together and come up with different tools and different aids to help them with their, just basic needs like cooking or, I just want to read the newspaper or I just wanted to be able to move around my house with a little bit more confidence. Those types of services and that type of care, I think is not talked about enough. It's definitely not accessible enough. It's definitely not something that, you can find really easily. I actually think you could find a scleral lens fitter much easier than you can find a low vision expert.
Really?
And so that type of care and that type of exam, I think, is severely underrepresented. And it's so important because similar to how I was changing about, scleral lenses, it's life changing. It's, again, someone feeling more comfortable just to be able to walk around their home. It's someone knowing that they can, sign up to be under the government legally blind and have all of these services available to them that they didn't know that they had before. Even just, something like a walking stick, something like that is also life changing as well and makes it easier for the patient to be able to function and to get around. And so low vision is an area of optometry that I have the utmost respect for. And I really think that it deserves a little bit more love.
Well, I didn't even know that. That was a great suggestion, and I didn't realize there was such an unmet need in that
Mhm.
segment of eye care. And you mentioned some examples of how low vision affects somebody's life, and it's like quality of life issues. I mean, being able to cook for yourself and get around your
Mhm.
home. I mean, those are things that you and I, as people with pretty good vision, well, I guess you have might as not,
Yeah, me without my contacts, no way.
that we kind of take for granted. But I mean, some with low vision, their life is impacted in a way that's pretty adverse. And so to be able to restore and help those folks see, I didn't realize that was such an
Yeah, and
unmet need. Well, thank
again, some of these tools and these aids they're not easy to come by. It's not like you can go to your local Walgreens or your local Target and, go buy it. You usually something that you have to get through, an eye care provider. I mean, I think Chicago, I only know one. It's the Lighthouse of the Blind. That's where I, refer all my patients to. But it'd be great to be able to have a clinic that's, where I'm at or a little bit closer that does those kinds of exams. They're hard to come by, but they're so needed.
I agree. So you work in such an inspiring environment, and clearly you love what you do. When you look at the next generation of optometrists coming up, what excites you most about where the profession is headed?
The access that they have to information, to be able to, again, we were talking about AI, just to be able to look have a condition, want to find out a little bit about it and treatment plans, like their access to information and how quick that they can get information, I think is really exciting. But I think the biggest benefit is just how optometry as a whole is expanding and how much our scope of practice is expanding depending on where you want to practice. Like you can go to a state where you can do things like lasers or small procedures. So you have those options now where if you want to use your license to the fullest scope, you have places where you can go to do minor procedures. You can do these lasers. If you want to just do more retail optometry, you can. There's so many options. If you want to do more medical, like that is expanding as well, and your access to those resources and those clinics is expanding as well. Your access to people with social media and to be able to network and to be able to put your name out there and, express what your interests are. And there's different forums and chat groups now where you can talk about cases and connect with other optometrists and get second opinions. I think that is really exciting. Just again, that access to information and how much our scope and it is expanding. I'm really excited, and I hope the new generation of optometrists really take full advantage and really step into how things are changing and change with the times.
You're not the first optometrist I've had on the show, and there is kind of a recurring theme, very similar to some of the things you said. So you're on the right track, and again, you're not alone. But what I find, and you've already done it, was really kind of specialized, because AI is going to take over some of it, but really finding that area, that niche, that area of specialization, and that it's of high need.
Mhm.
Is going to be where some of these newer folks need to start looking and exploring and really developing a lane for themselves. Because I think much like
100%.
you and others who've come on the show are saying that is where we need to be in order to not just survive, but thrive as a specialty in
Yeah,
eye
yeah.
care.
You definitely have to find like a niche, just kind of how I was saying, like standard monofocal cataract surgery. If that's what you're doing, you're probably not going to survive very much. I kind
Hmm.
of feel the same way. I think if you're just kind of a standard, just very routine, maybe you could survive. But I just think there's so much more space for expansion in terms of care and knowledge that we can provide to patients. And a lot of these specialties, again, they didn't exist. If they did exist, there wasn't too much available in terms of resources, treatments, or things that even some reps even care to have conversations with optometrists about, like a lot of dry eye drops. I'll even hear from the reps that, like, hey, we're starting to talk to ODs about this more. We're starting to have conversations with ODs more about giving you samples and doing the dinners with you guys so that you guys can come and learn about the products. Like, that's also a change that I've been seeing. Like, we were never really considered, or we weren't really a part of those conversations up until, the past couple of years. And again, that's really exciting. And that's something I always like to make my any ODs that get hired and are onboarded with our office, like, oh, I have 100%. I'm introducing them to all the reps. You're coming to all the dinners because I want you to know about these things and know that you have a place at that table, and you should have a place at that table because you are an important part of that conversation.
Yeah, well, it's I think above all, it's continuity of care. Yeah, you'll see your ophthalmologist to have your surgery, but what happens before that and after that? And so
Hmm.
that, again, that continuity of care from when the patient first dials into the office and like, hey, I think I have a problem with my eye, to when they
Yeah.
walk through, and when they visit with you, you're kind of really that you know lead hitter, if you will, on a baseball team. You're that lead. You're the lead batter, in the lineup. And so you got to get things started on the right foot. And so when it does get to your, 3 and 4 hitters like the ophthalmologist do the surgery, it makes their job easier. You're going to get a better outcome. Things are more efficient. But it's all about that lead runner. I think that's the position you guys are going to be really holding down in years to come.
Yeah, I definitely see our role expanding more in like the pre-op, like the and post-operative care. And also we know it's not news, it's long understood that the ocular surface with
Hmm.
any surgery is so important to be as optimal as you can. So even in the weeks leading up to
Yeah.
surgery, we're doing dry eye management on these patients. We're clearing up these corneas as as best as we can. We're treating we're treating the Demodex blepharitis before surgery. We're treating the ocular surface to help prep the patients before surgery. And that's on us. Like I take that that responsibility. And we take it very seriously because we want the best outcomes for these patients. We want the best surgery. We want the best experience for them. And we know how important an optimal ocular surface is for that to happen.
Well, if that's what you're doing at Family Eye Physicians, you're doing it right, and hopefully a lot of folks will follow your lead. So to close this out, for anyone listening who's thinking about a career in optometry or maybe just starting their journey, what's your best advice, and what's something you've learned along the way that you wish someone would have told you earlier on?
I think finding something in optometry, number one, optometry is such an incredible field. There's never a day that you're going to be bored. There's always new technology. There's always new pharmacological agents coming out. There's always new treatments. And so I think that finding a area of optometry, a specialty in optometry that you're really passionate about, and can really hone in on your skill set, whether it's low vision, whether it's specialty contact lenses, whether it's dry eye, whether it's aesthetics, to find something that you're really passionate about and expand on that. I do wish that someone told me that sooner, because my journey in specialty scleral lenses would have started a lot sooner. And I feel like I could have been even more ahead of the game and even more ahead with my knowledge, because it didn't really start until I was in my fourth year of optometry school. Whereas I could have been doing that my first year. I could have joined a club. I could have, started to connect with specialty lens fitters and, try to learn as much as I try to network with that community in Boston, as opposed to doing that at the tail end of my schooling. And so really trying to find something or find an area that you're really passionate about and expanding on that. And I do think that knowing the type of office and the type of clinic that you want to end up in after graduating is really, really important, and is really going to be of value to you when you are starting to do your interviews, when you are starting to do your applications, because you'll be able to cater your resume to that, as opposed to just, not really having much of a direction. And that's when those fourth year rotations are so important. And also if you do a residency, why that's really important as well.
Well, you finished strong there, Dr. Garcia. That's really sound and sage advice. And honestly, the perfect note to end our conversation on. So it's been a pleasure having you on the Q-Switch Conversations. Thank you for sharing your insights, your passion for your passion for patient care, and your vision for where optometry is heading. So we've covered quite a bit of ground today and touched on a number of relevant topics along the way. So I am certain there will be plenty of folks out there that will like to reach out to you to keep the conversation going. What's the best way for them to contact you?
You can contact me at Dr. Garcia at FamilyEyePhysicians.com. That's my email. Or you can find me on Instagram at the Latina OD.
Cool. And then do you have a LinkedIn?
Oh, yeah, that too. My LinkedIn, Azalea Garcia.
Okay. Cool. Well, thanks for sharing those. As always, I'd like to thank Riverside FM and Passionate Media for making this show happen. And of course, Meridian Medical for making it all possible. So the Q-Switch Conversations podcast is my way of giving back to an eye care community that has gifted me so much over the course of my career. And this platform is for you. So if you have something compelling to say, or know someone who does, I invite you to come on the show. Hit me up on LinkedIn or send me an email at d.spence@meridian.ch. That's a wrap for this episode of the Q-Switch Conversations podcast. Until next time, this is Spence, and I'm out.
You're listening to The Q-Switch with your host, Spence.